Hello everyone, welcome to my channel medtime.com. I am Prajwal and today we are going to discuss about one of the trending disease, that's thalassemia. So what is thalassemia? Thalassemia is nothing but it is a genetic blood disorder or it is an inherited blood disorder. It can cause body to make less healthy blood cells and less hemoglobin, or it will decrease the production of RBC cells and also decrease or alter hemoglobin level. Hemoglobin, which is present in RBC cells, and this is made up of two components. One is heme and another one is globin. Globin, which is a protein, and it is made up of two alpha chains and two beta chains. Now we can conclude RBC cells contains hemoglobin and hemoglobin is made up of two components, heme and globin. So what is thalassemia? Thalassemia is nothing but alter or decrease in hemoglobin level. So how it will decreases? Let's see. So globin, which is a protein which is made up of two alpha chains and two beta chains. Now we can say that decrease in production of alpha chains called as alpha thalassemia and decrease in the production of beta chains called as beta thalassemia. Alpha thalassemia. People who do not have produced enough alpha chain have alpha thalassemia. Individual who enables to produce sufficient amount of alpha globin protein, so that case is called as, that condition is called as alpha thalassemia. Chromosome of alpha globin made by 4 genes, 2 on each strand of chromosome number 16. Alpha thalassemia trait means presence of two abnormal genes called as alpha thalassemia minor. Alpha thalassemia minor is nothing but among 4 genes of chromosome, 2 genes are abnormal, and this condition is called as alpha thalassemia minor. If both parents carry alpha thalassemia minor, where 2 abnormal genes present on opposite side of chromosome, their offspring or child will get same condition, or that is alpha thalassemia minor. Here, if one parent carry alpha thalassemia minor with 2 abnormal genes on same chromosome, in another side, another parent carry single abnormal alpha globin gene on one chromosome. Among 3 genes, one gene is abnormal. So what happens that time? So there is a 25% chance to get a child with normal hemoglobin, 25% of chance with a alpha thalassemia silent carrier, and 25% of chance to get a child with alpha thalassemia minor, or 25% chance to get a child with hemoglobin H disease. So what? If both parents carry two abnormal genes on same chromosome, so that time there is a chance, there is a 25% of chance to get a normal offspring or normal child without any type of disease or disorder, without thalassemia, and 50% chance to get a child with alpha thalassemia, and 25% chance to get a child with major thalassemia. Here all the genes are abnormal. Beta thalassemia. Individuals who unable to produce enough or sufficient amount of beta globin protein having beta thalassemia. Beta globin is made up of 2 genes, one on each chromosome 11. If both the parent carry one abnormal genes among 2, then there is a chance, 25% chance to get a child with normal hemoglobin and 50% with beta thalassemia minor, and 25% chance to get a child with thalassemia major. Symptoms: iron overloaded. People with thalassemia can get an overloaded of iron in their bodies, either from disease itself or from frequent blood transfusions. Too much iron can result in damage to heart, liver and endocrine system. Second one, infection. People with thalassemia have increased risk of infection. Thalassemia can make the bone marrow expand, which causes bones to widen. That results abnormal in structure of bones, especially on face and skull. Enlarged spleen. The spleen aids in fighting infections and filters unwanted material such as old or damaged blood cells. Thalassemia can cause destruction of large number of RBC. This can lead to increase in the size of spleen. Diagnosis: complete blood count, DNA testing, prenatal testing, management, blood transfusions, growth hormone therapy, bone marrow transplantation.